this is important information we're getting, but a lot of it, can be a day of sad, right? We're going to pull the most worst statistic to tell you to try to get your attention. And so it starts out with, here's the most horrible thing that could happen. Don't pay attention to me. And these days can turn into a day of sad. But when we got to hear Dr. McGuire for the first time, it made me so happy that I came back and I smiled in the office for probably 3 to 6 hours afterwards. And that never happened. So I'm really pleased when Dr. Son suggested that we have him present here today. And you can read his bio in the thing, but he's got some great stuff to tell you, and please give him a listen.
Can people hear me in the back okay? Yeah? No? Not so much? Okay. I'm getting some thumbs up. I'll talk a little loud. Thank you very much. I'm really excited to come here today and talk to y'all about moral elevation, which I'm assuming most people haven't heard of before, so really looking forward to kind of sharing my line of research with you. As a quick disclaimer, I will say that I'm talking about the role of moral elevation in PTSD and moral injury. I'm not going to go into great depth in defining what moral injury is because Dr. Russell's going to present on that this afternoon. But for the purposes of this presentation, I'm talking about moral injury as some excessive shame, guilt, or anger related to either something a veteran witnessed or an act they performed themselves during combat. But Dr. Russell will go into much greater detail later on. So here's the outline of what I'm hoping to cover today, which is kind of a lot, but I'm hoping to get through it so that at the end of this you have a good understanding of what moral elevation is and an appreciation for why we can actually use this in treatment. And to start, I just want to highlight my overall general research focus is trying to understand how we can integrate pro-social emotions or emotions that involve praising other people into existing trauma treatment. And there's a reason that this is important. So first of all, if we talk about how we approach trauma treatment right now, we approach it with the medical model, which has already been referenced earlier today. But essentially what it means is we identify what's wrong with the patient, right? What's wrong with a veteran with PTSD? What are the symptoms? We diagnose it, and then we say, let's drain all of those bad things that are making someone feel uncomfortable, distressed, impaired. Let's get rid of all that stuff. That's the medical model. Now, obviously, this is something that we want, right? This is a good thing, but oftentimes, treatment stops there. That's the focus of treatment, and then it stops. But what happens if all we do is this? Then we're left with absolutely nothing, right? And when you think about, you can think about this for yourself, what you want in life, I'm sure you want more than just nothing, right? I certainly hope for my personal eulogy, I hope it's longer than, well, I can say he wasn't very sad, right? Like, I hope it's more than that. You want something else in your life. And ultimately, what we want is meaning, purpose, happiness. And I think we want the same thing when we care for our veterans. We don't want to we want to go beyond just alleviating their symptoms. We want to help them flourish and grow. And the treatment that we offer should reflect that. So what do we do to kind of attack this problem? Well, one approach is doing a positive overload. Let's just take a hose, turn it down to full max, and just pump them full of positive feelings and experiences, and they'll feel better. Obviously, that's not going to work. I'm sure most of you would probably agree with that. The grin and bear it approach isn't going to make PTSD symptoms go away. So what instead we need is something that's more in the middle that integrates the process of adding positive features into your life, but also removing the negative. So ultimately, what I'm proposing or wanting to do is find a way to use pro-social emotions to alleviate those distressing symptoms, but also help a veteran grow and flourish at the same time, and add these things like positive emotion, engagement, meaning, achievement. And ultimately, the research that I'm doing right now is trying to use moral elevation as this pathway. Perry, this is the part where you can step out because that's as many slides as I can do with 3 words or less, so I'm sorry. So let's get into the definition of what is moral elevation. Moral elevation is defined by 3 specific categories. It's what triggers it, how you respond, and then the behavior afterwards. So first, Moral elevation is triggered by witnessing a virtuous behavior. And what I mean by that is just seeing another person do something that's incredibly brave, kind, courageous, watching someone demonstrate incredible perseverance. That's the first thing that kind of triggers you to have this emotion. And then the response is an emotional and physical change. So the emotional components are feeling really inspired, uplifted, moved by what you just saw. And if you can think of a time when you were really moved by something you saw from someone else, you might also recognize that maybe you had tears in your eyes or a lump in your throat, or some people endorse having like this warm feeling in their chest or chills or goosebumps, right? So it's triggered by witnessing a virtuous behavior. You have this emotional and physical response. And then afterwards, it's followed by this behavior or this strong desire to imitate what you witnessed. I saw somebody do something incredibly kind to a random stranger. I want to do the same thing. I want to do something kind too. Or I saw someone do something really brave. I want to demonstrate bravery myself. And so ultimately what this kind of comes to is having a strong desire to be a better person or engage with other people. It's an active emotion. It doesn't just happen. It pulls you to do something afterwards. So what we do know with the existing research on this emotion, which is primarily in the civilian and the non-clinical population, is that this emotion has a lot of benefits. It leads to greater psychological health and improved social functioning. And what I mean by that is greater psychological health. People who report higher levels of moral elevation report less depressive symptoms, less anxiety, less hostility, greater positive affect. And then with the social functioning, people also report a strong desire to connect with other people, or people are more responsive to other people's needs. And several studies have shown that when you elicit moral elevation in a person, they actually do more pro-social behavior. They go out and help people. So clearly, these things that are a product of moral elevation could be immensely helpful for people with suffering from distress related to trauma, right? And really, when you think about it, the moral elevation is in some ways kind of the opposite of what happens with trauma. You know, moral elevation leads to better psychological health and improved social functioning. Trauma leads to PTSD, moral injury, which are all associated with distressing symptoms, lower impairment, lower social engagement, right? So these two things are kind of polar opposite. And what I'm suggesting is that we can use moral elevation to potentially reverse the negative effects that we see in trauma. So, real quick, I want to kind of demonstrate what that looks like specifically. So if you think about how moral elevation works in these three different categories, you could imagine a veteran with either with significant PTSD or severe shame or guilt, and picture what would happen if they were to go through this process of experiencing each of these moral elevation components. So witnessing a virtuous behavior, you know, a lot of people with severe PTSD have thoughts like no one can be trusted, right? They have strong negative beliefs. But if you're experiencing moral elevation, you're witnessing someone do something incredible, and so you're helping build the case of why might I look at the world in a different way. Same thing with the response and the emotional and physical changes. A huge problem for people suffering from trauma distress is emotional numbing. How many times has someone heard, you know, I can't feel good things anymore, right? That's the opposite of what moral elevation is. It's lifting you up. It's making you feel moved and touched by something meaningful. And also, there's also research to suggest that moral elevation can impact our physiology, and it can change the way that our bodies regulate our heart rate. And so that also could apply to the strong negative emotions that people feel. If moral elevation can help regulate those emotions, then that could also be helpful. And maybe the most compelling is the behavior component, right? So imagine a veteran who has severe PTSD and has this really strong desire to do something incredibly kind after witnessing that. Well, they have to approach something. They can't do avoidance anymore if they're going to do that, right? They can't be isolated and also go help someone. So acting on that behavior could be incredibly therapeutic just by itself. And then also with moral injury, there's a lot of thoughts about I'm a bad person, or even maybe feelings of self-disgust. But by imitating virtuous behavior, you're again building the case for, hey, I also have the capacity to do good things as well, right? So, up until now, as I mentioned, moral elevation has really only been looked at in civilian non-clinical populations. So I started a small pilot study in Jackson, Mississippi in a PTSD residential program that involved about 10 to 12 veterans at a time. It was group treatment. And what I asked them to do every week was fill out this elevation by group measure, which essentially asked, when you reflect on the past week, how much did you feel elevated by the actions of your fellow group members? How much did you feel like you wanted to become a better person because of what you saw your fellow group members do? And so they did this measure every week, and then at the very end, it asked this question about Walk the Walk Awards, saying, you know, now that you've kind of reflected on the good behaviors of your group, who would you like to nominate as someone who really demonstrated incredible effort and behavior this week during their treatment? So then we would do this whole thing where we tally it up, and at the end of the week, we would give, you know, a certificate and present it to someone who's like that won the Walk Award for that week. So, like I said, this is a preliminary study, but what we did find is that when veterans reported higher levels of moral elevation, they reported greater engagement with their group. They also reported lower avoidance symptoms at post-treatment and lower moral injury distress at post-treatment. And again, this is still preliminary data, so it's a small sample size, and the study is ongoing and still collecting more data. But the point of this is that prior to now, this is kind of just a theoretical link between moral elevation and PTSD and moral injury. But this is kind of the first stage at setting up some evidence to say that there might be something to this that we can actually use. This might be one pathway that we can achieve alleviating distress, but building or facilitating growth at the same time. And so a quick case example from my work there of a veteran who really demonstrated this nicely. He was a Vietnam veteran from rural Louisiana, and he did really well in treatment, and I worked with him individually as well in addition to our group stuff. And towards the end of group treatment, he told me how much he was moved and touched by the care he witnessed in his group. He would talk about seeing fellow veterans care for another or offer incredible support to someone who was maybe having a really hard time with treatment, because as most people know, trauma treatment is not easy, right? So offering incredible support and care for other veterans, and then also being moved by the amount of holistic support that the clinic offered him, because when he came back from Vietnam, he said that that was not available to him, it's not something that people talked to him about, and so he was kind of alone and not really supported. So at the end of treatment, what he told me is, you know, I'm so moved by all of these things that I've witnessed. What I'm going to do is when I get out, I'm going to go back to my local VA, I'm going to volunteer for transportation services, and I'm going to drive veterans who can't get to the clinic to the hospital so they can get their PTSD treatment, because I want to care for other veterans like I saw veterans care for me and my group members. How cool is that, right? Like, I'm getting like chills just talking about it, because I remember him telling me specifically, and that's an excellent example of what this could actually look like. Now here's the crazy thing though, is that he did this completely on his own. As much as I would like to take credit for him doing this great thing, this was completely on his own. I didn't actually say, okay, now here's the behavior tendency, what would you like to do next, right? And I'm sure, talking about social workers and providers, I'm sure many of you can think of a couple stories where you were really moved by some things like this that veterans did. It's the thing that keeps you going. It's the thing that keeps you going as a therapist, right? So this stuff is already happening in clinics, in treatment, but imagine what would happen if we used it, right? Like if we actually identified this as a tool and intentionally used it, imagine what kind of difference it could make in veterans' lives. And think about this specific veteran. How helpful is it going to be for him to go back and instead of just staying at home and isolating, getting out, helping other people, seeing people every day, being active? It's going to be incremental to his trauma recovery. So now the next step that we want to do is actually identify how we can use moral elevation in treatment, like I just described. Because right now, the existing research just says what happens in the clinical population, but what we need to understand is how can we use it effectively in treatment if it has these effects. So the first phase that we're actually getting ready to start right now is an experimental study at the Center of Excellence where we're bringing in veterans with PTSD and moral injury, and we're going to show them elevation, we're going to show them videos that elicit moral elevation. And we're going to measure how does that change their emotions, their thoughts, and also we're going to do some physiological measurements to see how does their body react, how does their heart rate change when they're exposed to these videos, to really highlight what are the specific effects that might be unique to veterans, and how might that be useful when trying to tackle maybe shame or guilt. And then further down the line, we want to develop specific interventions that actually use moral elevation. And hopefully within the next 2 years, we've already started developing an online-based moral elevation intervention where people can just do the entire intervention online by logging on their computer, and we're hoping to launch that within the next 2 to 3 years. But that's the next phase, is trying to identify how can we integrate this into treatment. Because ultimately, like I said, what we want to do is improve the way that we administer treatment now and improve the actual recovery and long-term outcome of veterans with PTSD and moral injury. Thank you very much for letting me speak to you today. And if you have any questions or thoughts or interests in this subject, please email me. And yeah, thank you again.